Apollo Hospitals, Bangalore has become the first hospital in India to receive dual certification from the American Heart Association as both a comprehensive stroke center and a comprehensive chest pain center. This prestigious recognition highlights the hospital's ability to provide world-class emergency care for stroke and heart attack patients, where every minute can make the difference between life and death. The certification follows a rigorous international assessment of the hospital's emergency response systems, multidisciplinary coordination, advanced diagnostics, and critical care capabilities. According to Apollo Hospitals, the achievement reflects years of strengthening emergency care pathways to ensure faster diagnosis, quicker treatment, and improved patient outcomes. The American Heart Association stated that Apollo Hospitals, Bangalore has successfully met internationally accepted standards for managing complex stroke cases and acute heart emergencies. With cardiovascular diseases and stroke continuing to be major causes of death in India, this milestone sets a new benchmark for emergency healthcare and reinforces Apollo Hospitals' commitment to delivering globally recognized standards of patient care.
Namaste. So we are from Apollo Hospital, Bangalore. We are proud moment for getting the American Heart Association certification for both chest pain and stroke center as a comprehensive specialty center. This is the first in India which we achieved for both the specialty certification. The continuous process, the pathways, the protocols has been met as per the guidelines of American Heart Association, which they were convinced with the thing, and they issued us we were the best center in India to get this certification. This is about a certification. Now we are talking the outcomes, how we are going to improve this, which we started following since last November. The guidelines of this stroke and chest pain has been implemented in our center. A patient comes with a stroke or calls our emergency helpline 1066. Our ambulance, which is completely equipped like an ICU, which will be manned by emergency physician and a paramedic, will reach us the hospital, from the hospital to the patient with our smart ambulances. The treatment begins from the time the patient has been picked up. En route, it has been monitored by our emergency department as a command center, and even if we require any specialist involvement, will be directly guiding, evaluating, and the treatment will be continued en route until the patient has reached the hospital. The time the patient reaches the hospital, the training has been done from the security to the doctors, to the nurses, up to the transport and to the technicians, where everybody is aware in the hospital. The time we announce immediately something called as a code fast, which goes as overhead paging, and also it comes to all the consultants who is involved in this. So the treatment is kept ready, the scans are kept ready, everything will be done in a quickly manner. If a patient comes with a stroke, we monitor something, what is a door to CT scanner MRI, what is a quick report, how quickly you will do, and how quick we are going to thrombolize the patient, and this will lead to a good clinical outcome, which also comes with a chest pain. The time the patient has entered our department, how quick we are going to do the ECG, which is of a benchmark of less than 10 minutes. Immediately the loading dose of medication of giving aspirin, the statin, within 10 minutes, which we are giving. And again, shifting to the cath lab, from the door to cath lab and the investigation, where the turnaround time is less than 40 minutes, which we receive. And also the patient is shifted to cath lab and door to balloon inflation, which is less than 90 minutes. We have seen a great outcome after the implementation of these policies and protocol. 50% time which we used to do early, than that we have started achieving lesser time, and there's a good outcome and a team effort. Everybody in the hospital is in the management and treatment plan with this, and we are very happy, and we will be continuing this for the patient outcome, and also we will be spreading to all our other branches, and we will be doing with the good community training program, which we were doing and will be continuing for spreading this awareness program for the public to go to the ready stroke center and ready chest pain center, where the treatment can happen immediately within minutes and within seconds, what we talk about a golden hour, without any complication.
Narayan Sharma. I'm a senior stroke specialist and neurologist in Apollo Hospital, Bannerghatta Road. Today we are proud to announce that we are the first hospital in India to get dual certification from American Heart Association for Comprehensive Stroke Center and Comprehensive Chest Pain Center. So why stroke is so important? In Bangalore, approximately every day around 50 acute strokes are happening. And if you don't, take the patient within the golden hour of acute stroke, patient may land up in permanent deficit and some patients may die. So first 4.5 hours after acute stroke is called as the golden hour, where lot of advanced treatments are available. So there is something called intravenous thrombolysis, where we give a clot busting drug to lyse the clot and restore brain circulation, which can be given within 4.5 hours. There is a procedure called mechanical thrombectomy or the brain angioplasty, wherein we are going to remove the blood clot within the brain and restore the brain circulation. That can be done up to 24 hours. So any patient who presents with stroke symptoms has to come to hospital within the golden hour. How do you diagnose acute stroke symptom? Most importantly, we identify what is called B fast, BE-fast. B is loss of balance, E is eye signs, F is facial deviation, A is arm drift or arm weakness, T is S for speech difficulty, and T is time to act fast or time to call for help. So with this message, I would like to request everyone to spread the stroke awareness message and patients to get treatment on time. Thank you.
Today, we are proudly announcing that Apollo Hospitals Bangalore is the first hospital in India to get a dual certification from American Heart Association. American Heart Association is a 100-year-old association which recognizes fantastic work done by various hospitals around the world. Even in the USA, only a couple of dozen hospitals have this kind of certification. So it is a matter of great pride that in India there is a hospital that has received dual certification. We at Apollo Hospitals Bangalore are very proud that we have been able to receive this certification, and we will be able to provide the best of services whether any patient comes for a stroke or chest pain to our hospital. Every single staff is trained to provide the best of services, and we will ensure that the standards are always kept excellent and we provide the best of services to all patients. Thank you.